Gwen, how educated are doctors? I'm sure it runs the gamut where some do some research into certain drugs that people like you used to talk to them about, but you don't really know what you're going to get when you go see a doctor and how much work they've done when they prescribe you a medication.
You're absolutely correct. And for the most part, I'm not anti-doctors either. I believe that healers, they go through the extensive amount of education that they do, and all of the training, and they make a lot of sacrifices when they're in school. And I think they do that because they truly want to help people. However, the environment of healthcare, the healthcare environment, the insurance requirements, the HMOs, the massive amount of paperwork and stuff that they have to attend to, they are not capable of keeping abreast of all of the information. There's over 8,000 drugs on the market. They would have to sit down and literally, continually educate themselves in order to keep abreast of just what's out there, much less the new things that are coming out on the market. So doctors very heavily depend on the information that they get in medical meetings, that they get from their pharmaceutical rep visits, that they get from certified medical education training that's generally 99.9% of the time supplied by the pharmaceutical industry, and then their own, little bit of research that they may do in journals. And unfortunately, the journals are all now, chock full of ghost-written articles that are financed by the pharmaceutical industry, and then someone pins their name on them. So they're really not getting good information anywhere. Even if they do their own due diligence, they have to be very, good about it in order to get good information.